Alright, in this video I'm going to be doing inspection, palpation, followed by pulse palpation, and then auscultation, and this is on the peripheral vascular system. So when it comes to inspection, I'm just going to be looking for redness in his skin, all across, just to make sure there's no cyanosis, so just like blue skin or pale skin, making sure his fingers are nice and healthy, there's no Raynaud's or something like that, or peripheral vascular disease. Also checking his feet, just making sure everything is fine. Is it okay if I take off your socks? Alright, just again making sure that the fingers are nice and, they're not pale, nice in color. So that's inspection. After that, I'm going to move into palpation. Palpation is just temperature check. I'm feeling that there's no areas of warmth. Everything feels nice and normal. Is it okay if I lift this up? Yes. So I'm just checking the skin. Alright. And if he had like a specific hot areas, that could be a venous problem, specifically with some edema. If he had very cool areas, that could be some vascular problem where there's no arterial flow reaching that area. Next, I'm going to be moving into pulse palpation. With pulse palpation, I'm going to start with the temporal pulse, and then I'm going to do that bilaterally. So I'm starting with the temporal pulse. Okay, and then I'm going to move on into the mandibular pulse. Okay, and then I'm going to do the carotid pulse. For the carotid pulse, you want to do it unilateral. You don't want to do it bilaterally because the patient can faint. Alright. Then I'm going to be moving into the antecubital pulse. For that, okay. Perfect. Then I'm going to be moving into the radial and ulnar pulses. So I'm doing the radial pulse right now, and then the ulnar pulse. Alright, perfect. We want to be moving from proximal to distal always, except that when we come to the foot, and then I'll talk about that once we reach that area. Alright, so now I'm going to be doing the, I'm going to check for the abdominal aorta pulse. So is it okay if I lift up your gown? Okay. I need that abdominal aorta. Looking for a pulse. And I'm going to try to contact the iliac pulse. It's going to be down here. And then the femoral pulse. For the femoral pulse, I'm going to ask the patient if, can you tuck in this under your shorts? Just like tuck it in under your shorts. Okay. So he already pulled it down, so we want to be down there feeling for that femoral pulse. And then, okay, after that, we can go ahead and move down into the popliteal pulse. But before that, this is what I meant. If we found the femoral pulse, instead of moving into the popliteal pulse, we should palpate the posterior tibial and the dorsalis pedis pulses first. So the posterior tibial pulse is going to be here in the behind the posterior medial malleolus. Dorsalis pedis is going to be over here, under the extensor digitorum area. And then, if we cannot find the pulse here, which I just found it, we can move into to find the popliteal pulse. It's going to be under here. Okay. This one's a little harder to find. It's just kind of have to dig in there in that popliteal fossa, and this is not that hard. After pulses, that concludes pulses. Now I'm going to be moving into auscultation. For auscultation, for artery auscultation, specifically these, the bell side is better. So we're going to start with the temporal pulse, and then we try to listen to bruits. If the patient is healthy, there shouldn't be any bruit sound. Bruits in any of these areas is considered abnormal and a pathologic finding. So after the temporal, we move into the carotids. After the carotids, we move into the subclavian. After the subclavian, we move into the brachial artery. Okay. After the brachial artery, we can do the radial and ulnar arteries. Okay, after the radial and ulnar arteries, we can move into the abdominal aorta. It's going to be up here. And then the renal arteries, which is just slightly above into the sides of it. Listening for bruits. Then we move down into the iliac arteries. And then the femoral arteries. After that, we can move into the dorsalis pedis arteries and the posterior tibial arteries. And then finally, we can do the popliteal artery. All right. So that is inspection, palpation, followed by pulse palpation, and then auscultation of the peripheral vascular system. Okay, this is called George's screening procedure. Sir, I'm going to be taking your blood pressure, feeling some pulses. Is that okay?
Yes, sir.
Okay, so I'm going to start taking his blood pressure on his left brachial artery. Okay, just go ahead and relax. Don't cross your legs. Relax your arm there. There you go. Okay, he had 120 over 70. Okay, don't cross your legs and relax. Breathe normally. And, his rating on his right arm was 118/70. Now I'm going to go ahead and feel for his radial pulse bilaterally. Okay. And then I'm going to listen for bruits at his subclavian artery and carotid arteries. It's better to use the bell for those. All right. Hold your breath. All right, breathe. And hold your breath. And breathe. So, positive test would be if he had a 10 or more millimeters per mercury in the blood pressure reading between left and right arm, a difference in his radial pulses, or if I heard a bruit in either the subclavian or carotid artery. And any of those findings would be indicative of a subclavian artery stenosis. Okay, this is called Colemans Test. And sir, do you have a pain or numbness or tingling in either leg? No? So you would do this in the uninvolved side first. However, I'm going to start on his right leg. I'm going to dorsiflex the foot, and then I'm going to squeeze the calf. Does that cause you any pain? Huh? Alright, I'm going to repeat that bilaterally. Let me know if that causes you any pain. Anything? No? Alright, so a positive test would be pain or on pressing on the calves, and that's indicative of a thrombophlebitis. Okay, this is called Lavelles Test. Sir, what I'm going to ask you to do is go ahead and cough and let me know if you feel any pain. Do you feel any pain?
Here.
Okay, so he feels pain in his right upper calf muscle. What you do, the patient might feel pain anywhere, and what you want to do is occlude the veins a little higher up, and then repeat this and see if that changes in any way. Okay, sure. So I'm gonna be pressing onto your leg. Let me know if that feels better. So you wanna press the area proximal to where he feels the pain. So I'm gonna press right here. Go ahead and cuff. Does that feel better?
Yeah, a little bit, yeah.
Okay, so that's a positive sign, and it's indicative of thrombosis. Alright, this is called the ankle brachial index. Sir, so I'm going to be taking your blood pressure. Is that okay? So first I will take the patient's blood pressure on his brachial artery. Alright, so remember, make sure that the arm is at his heart level. Relax, don't close your legs. Breathe normally. So his blood pressure is 120/70, and then we want to compare that to, go ahead and lay down on your back. his lower extremity blood pressure. So since we took the blood pressure on his right arm, we're going to take his blood pressure on his right lower extremity. Alright, so I'm going to be placing this on your leg. Is that okay? Okay, lift up your leg a little bit. There you go, relax. Okay, and then when you're doing lower extremity pulls, blood pressure, it's easier if you do it by pulls. So I'm going to go ahead and do that. With the pulse, I can only take the systolic blood pressure, and you can either feel for the tibialis posterior or the dorsalis pedis arteries. In this case, I'm doing the tibialis posterior. Okay, so I feel the pulse, and then I want to add pressure until I don't feel the pulse anymore, and then go 30 more. And then feel for when I start to feel the pulse back. And it's at 120 as well. So, yeah, so 1-to-1 ratio. A ratio, if the blood pressure reading is different, you divide the lower extremity blood pressure by the upper extremity blood pressure, and a ratio of less than 0.9 may be indicative of claudication or ischemia. Okay, this is called the burghers test. So I'm going to be lifting your feet around, asking you to move it, let me know if you feel any pain or discomfort. Okay, so remember, always starting the non-involved side. Have you been feeling numbness or pain in either leg? Now, okay, so I'm going to lift the leg up to about 45 degrees. And then, sir, can you go ahead and move your foot backwards and forwards? No, just like pedal. There you go. And then I'm going to ask him to do this for 3 minutes. Go ahead and continue doing it, please. Don't stop. So I'm going to ask him to do it for 3 minutes. And for the sake of this video, I'm going to go ahead and say that the 3 minutes are up. But while I'm here, I'm looking for paleness, if his foot turns extremely pale, or if the superficial veins collapse. Alright, sir, can you go ahead and sit down? And then just place your feet in the, sit down facing me. So here, I'm looking to see if the foot turned slightly red, which it did, but it already went back to normal. Positive findings would be if it takes over a minute for the redness to go away to normal, or if the foot is extremely red or blue, or if the superficial or the veins here descend. Those are positive findings, and it's indicative of some arterial occlusion or perhaps some problem with the venous valves. And then I'm going to go ahead and repeat this on the other leg. Can you go ahead and lay down on your back? Alright, lift the leg up to 45 degrees and go ahead and move your foot backwards and forwards. We asked the patient to do this for 3 minutes. For the sake of this video, I'm going to say 3 minutes are up. Go ahead and come back. And then I'm looking at the foot, see if it turns red, if the redness went away, and all those findings that I mentioned previously. Okay, this is called Lavelles Test. I'm going to go ahead and sit down, please. I'm going to go ahead and feel your pulse. Let me know if you feel any pain or discomfort, okay? So you can either feel the dorsalis pedis or the tibialis posterior pulse. I'm just going to go ahead and feel the tibialis posterior pulse. And I'm looking for symmetry and strength. They're both symmetrical. He has a +2 pulse. Now, sir, can you go ahead and stand and run in place until you feel your symptoms? Let me know when you feel your symptoms. There. Okay. Can you go ahead and sit down? And where do you feel your symptoms? So I'm going to go ahead and take the pulse again. His are both still symmetrical and the +2. Now, if his pulse was actually weaker, if it decreased, or if it went away completely in either both or one leg, or if the pulse was asymmetrical, that would be a positive finding for arterial insufficiency. Okay, this is called the Lavelles Test. Sir, do you feel any pain or tingling in the hand? No, sir. I want you to go ahead and you want to start with the unaffected side first. Open and close your fist. All right, and then we want to have the patient do this for several seconds, and then go ahead and close your fist and stop. Close your fist. I'm occluding the radial and ulnar artery, bringing the arm down, and then releasing one side. Open your hand, and I'm observing for the color to return. So it was a little pale, and it's now back to normal. And then go ahead and do it again. Open and close, open, close. Again, I'm occluding both the radial and ulnar side. This time I release the ulnar artery. Open your hand, and then the color returns. I'm going to repeat that on the other side. Open, close, open, close. Alright, close your fist. Occluding the radial and ulnar artery, releasing one side. Perfect. And then repeat. Alright, close your fist. And releasing the other side. Alright, good. So, a positive finding would be if it takes longer than 10 seconds for the normal color to reappear, if the hand turns extremely red or blue, and that's indicative of either radial or ulnar artery occlusion.